My name is Tracie Lee, and I'm from Eau Claire. I had the gastric bypass. I was very overweight. In the last few years prior to my surgery, I had really gained a lot of weight. I was unhealthy. I had high blood pressure, was taking a couple different kinds of blood pressure medication. I was unable to exercise, be as active as I wanted to be. I was very sick. I have MS, and I was very sick with MS and kind of getting more and more depressed as I was growing, and knew that a change had to be made very soon, or else I was probably not going to live very long. I had been on every diet out there, and I would lose weight, but then I'd fall off the wagon, and I'd usually find myself 10 or 15 pounds heavier than when I started. I had been thinking about having the surgery for a couple years prior to actually doing it. I went in for a consult and I chickened out. I did have apprehensions. I was very afraid to have the surgery. I was afraid of giving up my comfort, my crutch, my food. I was afraid of something going wrong. I was afraid it wouldn't work for me. I chose Gundersen because I was very happy with the reviews and the research that I had done. Once I came here and met everybody, I met the crew, I just knew that this is where I wanted to be. They told me exactly, what to expect, and I felt very comfortable afterwards. And if I did have a problem, everybody was just a phone call away, and they were very helpful. There was a lot of education beforehand. You go through classes here. You really have to prepare yourself. There's psychological, evaluations that you have to go through. There's lots of visits with a dietitian, just telling you, what you can expect afterwards, how you're going to need to eat. Instead of, 3 giant meals, you have to eat kind of throughout the day, and you have to strategically plan what you're eating in order to get everything in there. In getting ready for the surgery, I basically started doing all the things that I knew I was going to have to do after. My expectations were to, obviously lose some weight. I had no idea I'd lose as much weight as I did. I wanted to lose about 100 pounds, and I ended up losing, way more than what I expected to lose. I lost 151 pounds. It took me about a year and a half to really lose all the weight that I needed to. I lost a lot of the weight in the first year, and that was pretty easy weight. It just kind of came off. The next 6 months was more hard work on my part. I really had to exercise and eat healthy. Really, to get to my goal weight, though, it did take me 4 years. The hardest part after surgery was probably learning how to eat. I remember getting full just taking my vitamins, and I was like, oh, that's hard, just to eat that very small amount, and learning how to eat the right way. All of my cooking habits, eating habits, everything changed. My diet consisted of, a lot of fast food, a lot of, chips, junky foods. With the surgery, I had to expand what my eating was. And I tried all kinds of different things. I found that my tastes for a lot of things had changed. I started a garden, and I garden and grow my own vegetables and eat a lot of fruits and vegetables. I had constant support from Gundersen. I had, dietitians to talk to all the time, support groups. After surgery, it's kind of nice to know somebody and talk to people who have had the surgery, who can relate to what you're going through. I would recommend this surgery to anybody. Make sure that you're ready. You really have to make that commitment to change. Oh, this surgery changed my life in so many positive ways. I'm healthy. I feel healthy. I can get up in the morning and feel like I actually have ambition. There's something new, for the day, and I'm so active now. I can remember before surgery when I was heavy, I'd get done with work and I'd sit home and I'd watch TV. And that was kind of my life. Now I don't think I watch an hour of TV a day, if that. I'm doing all the things that I wanted to do. When I was bigger, I just never did. I ski quite a bit, which I couldn't do before because the ski boots wouldn't fit around my calves. I jog, I exercise. I'm very active with my son. I go out dancing and having a good time, and I never did any of that when I was heavier. I didn't want people to look at me. My overall health has improved. I don't take any more high blood pressure medication. I am able to control it with my eating, and exercise. My MS is much better. I just have such a positive outlook, not only about myself, but about life in general. I feel like I have something to live for, something to, I want to stay healthy to live longer because I'm happier. My friends, they can't believe that I look the way I did before. When I bring out pictures of how I looked before, everyone said to me, I just never saw you that big. You didn't look that big to me. And now, most of the time, I'm finding myself, I'll run into people that I knew years ago and they don't have any idea who I am. I'll go up and say, hey, how are you? And they'll say, who are you? So I find that most people don't even recognize who I am. I feel very accomplished that I've been able to get to my goal and keep my weight off and keep working towards a healthier me.
My name is Matt Baker. I'm a general surgeon and bariatric surgeon here at Gundersen. I've been here almost 10 years. I chose bariatric surgery because during my surgery residency, one of my mentors was a bariatric surgeon. I think the thing that impressed me most was the impact you can have on people's lives. The most advertised reasons for pursuing bariatric surgery is because of the impact it has on what are previously considered uncurable diseases, such as high blood pressure, diabetes, and sleep apnea. Now, the impact of bariatric surgery on diabetes is that statistically about 80% of patients will go into remission or have normal blood sugar levels without medication. As far as the blood pressure goes, about 50% of patients will be able to have normal blood pressure readings off their medication, or if they're on several medications, they'll whittle it down to 1 or 2 to maintain that same control. What I tell patients when I see them on their first visit is I say, anywhere along the way as you're preparing, you decide this is not for you, just let us know, and that's not a problem. This is a journey. It's not an operation in isolation. It's not just a surgery. There's a lot of preparation that's required before surgery. Of course, there's the operation and the recovery from that, but then that's when the journey really begins, making those lifestyle changes that they've learned about. They're forced to do certain things because of the surgery, learning how to adapt to that. And we try and just be very open with them, answer all their questions, and make sure they understand. And I think understanding alleviates a lot of fears. Well, I think a team approach is very important with bariatric surgery because it's more than just an operation, it's a lifestyle change. And so we have nutritional professionals, we have psychological professionals that get involved at a very early stage with the patient. There are other professionals that are available if needed, if they have lung problems that need specialized care, if they have heart issues that need specialized care, we'll also get those providers involved as well. The expected outcomes from bariatric surgery depend a little bit on the type of procedure you have. The most famous or most popular procedure is the gastric bypass. And most patients can expect to lose 60 to 70% of their excess weight. Well, as I mentioned, surgery is a very small part of the journey, and follow-up is important. The patients are seen 3 weeks after surgery by the whole team, see how things are going, make sure they're recovering well and that sort of thing. And then our nutritionist and our outpatient physician assistant will see the patients every 3 months. Everyone loses weight after the surgery. How much depends on the patient, depends on a lot of things, but everyone loses weight after the surgery. But once you kind of plateau on your weight loss, I think that's when the support becomes very important in patients that are struggling. Maybe they're seeing some weight come back on. They need to talk with a nutritionist, find out what's going on, find out where they can make some changes, get things turned around quickly. There's also patients that, struggle emotionally. It's a life changer in many ways. And maybe their social circles are different now. Maybe they've lost some friends or gained some new friends because of this transformation. And so we have our psychologists available to talk with them if needed, try and keep them grounded and successful. Every spring we do hold what's called a Bari Ball, where any patient that's had the surgery is invited. The idea actually was from Dr. Katari, who started the program here. He heard of an orthopedic surgeon who did a ball for his hip replacement patients, so they could come and dance for the first time, because of their new hips. And so that inspired the idea that Well, that's a similar kind of thing in our patients. And so it's wonderful that Gundersen supports that activity every year, and the patients can come and just have fun and enjoy a part of their new life with people that have gone through the same experience. It's very popular. It's fun. It's fun to see them out there dancing, and it's, you know, it's fun because we only see them once a year perhaps as their surgeon, and so they like to make that connection again and have us see them in their new life and the success they've achieved. They enjoy that, and it's satisfying to see that too.